Perfect. Okay. So thank you for everyone for having me. By show of hands, maybe who was able to listen to last week's webinar? If so, great. If not, no big deal. I just want to know kind of how much backstory to kind of give. Okay, so a few of you. Okay, so we'll just do a little brief overview of some of the components. I don't think it ever hurts to review. And then that kind of gives everyone else that wasn't there a little bit of context as we roll forward. So one of the things we talked about last week was body grief. And when I say the word body grief, kind of what we're going to look at is the 6 stages of grief, right? So we have shock and denial, anger, bargaining, depression, acceptance. And the most recent one that was just actually added to the stages of grief is finding meaning, which that one usually comes at the very, very end, not necessarily in the process as much. And the stages of grief aren't linear. Because we just slide in and out of them, even over time with chronic health issues, that people can be feeling like they're in a really good place with grief and or body grief. And then it can kind of just has a little sneak attack sometimes where we'll suddenly hit a wave or, see something that reminds us of a part of our bodies or a part of our prior experience that we've missed, and it can kick up some of those components. So I just kind of wanted you to think for just a minute about like, what phase of grief do you feel like you're currently in surrounding your body and your body image? You don't have to share it. I just want you to kind of think through where that is according to those stages, and also maybe where you've been, and if you've been in and out of them, or if you're just like, I've just kind of recently started and I'm just stuck in anger, I'm stuck in, the depression pieces of it, or whatever might be coming up. There's not a right or wrong answer. It's just a part, unfortunately, of the human experience with grief and body grief. And it's something I don't feel like is talked about a ton, even within my field. When I was looking for like TED Talks and a few things to kind of give you guys the resources, it's like there just really isn't that much out there about this specific issue, because I think it's often just oversighted in the eating disorder community, which is my background, right? But then I just think the general community at large hasn't been talking about it. So just want you to kind of think about where you're at. And then just kind of look at, like, when we're looking at like, what's to grieve, like, and some of this was in the slides from last week, but a lot of times what we're going to grieve is things that have to do with just our bodies as they were before cancer. And then obviously like things you've experienced during your cancer treatments and outside of cancer. And the reason I like to explain that too is because a lot of people do experience body grief, even if they haven't had a chronic illness, as they age, or they don't live up to this idea that they've had in their head that they always thought their body should look like, or they wanted their body to look like. We tend to grieve the ideal of whatever we were kind of socialized into believing beauty should look like. And that's going to be nuanced depending on, last week we talked, kind of like your family culture, your circles of influence, the broader based culture, like in the United States, has a very narrow definition of what beauty should look like. And even when other countries have been exposed to that, they definitely start to pull towards the cultural exposure in terms of body image. It can impact that. A lot of times people grieve like how their body looked at a certain age, right? Thinking, oh, I should look how I look after, before I had babies, or before I was this age, or kind of holding on to this image in our head of what we think or what we wish our bodies would look like in the here and now. Right. And that's called what we call like ambiguous grief in the grief world, which isn't necessarily something specific, but kind of a nuanced idea of what we thought our life would be. And I'm sure that resonates for all of you, because I'm sure none of you plan to spend your afternoon, right, in a breast cancer group receiving support. This wasn't anywhere on your life vision of how you hope this would play out, right? And so that's very much the loss of the ideal of how you felt like your life would work. And then obviously specific things in terms of like body functionality. So obviously we're gonna unpack this a little bit more, but just the inability to participate with intimacy with ease. If that was something, and that doesn't mean it what came with ease before, because there's lots of reasons that sex can be complicated, right? But if that was something that you were able to do with ease before, but now you get caught in your head, or you have a lot of anxiety or body grief, then just thinking about how that has shifted and how that's had an impact on your current sense of self and your relationships can be really difficult as well, and part of that grief. We often grieve the functionality of like how our bodies work, and that could be like sexual performance of things have shifted, or sexual preferences of things have shifted with surgeries and energy and all that goes with that. And there can be a lot of grief for ourselves and, fear about how our partners, in the moment or partner may have down the road may experience your body or experience grief about the shifts in how you feel like you're able to show up in that relationship. And that can bring up a lot of emotion and fear. And body image just in general, I think it's a pretty tough topic. There's just a lot of, it's like Pandora's box a little bit when we open it, but then we add in the bedroom and sexual components to it, it just takes it to a whole nother level. And so I kind of wanted to talk about why that is, so that as you're experiencing it, you can give yourself context and some compassion, because what the research shows is if our brain doesn't know that what we're experiencing is normal, it actually gets more dysregulated and more keyed up. And the problem is the more we get keyed up, the more our brain goes in defensive mode, and it picks up nuances in our environment that are perceived as a threat. So if our partner doesn't look at us quite in the exact same way and we're really relaxed, we don't think twice about that. If we're keyed up in distress, we're going to interpret that in our brain as some type of a negative message. It may not be accurate, but our brain has to make sense of things. And so it tells us as internal dialogue that may or may not be accurate. And so I want us to kind of just answer a couple questions. Or just fill in the blank. First word that comes to your mind. Vulnerability is, just think about what word came up for you. Okay, next question. Vulnerability feels like blank. And lastly, I grew up believing vulnerability was blank. So as we unpack that a little bit, Brene Brown is the person that talks very most about vulnerability and connection. And she talks about 4 myths of vulnerability. And the first myth is vulnerability is weakness, right? And how she describes this, I love. She says, vulnerability is the first thing we want to see in someone, meaning we want someone to show up and be real. Like that resonates with us. We feel trust with people who show up and be real, but it's the last thing we really want people to see in us. So when someone's being vulnerable with us, it feels like courage to us as the recipient of that vulnerability. But if we're being vulnerable, we almost feel weak or embarrassed or shameful or bleh. I think at least is a really good word for that in terms of being vulnerable. So that's one of the myths of vulnerability, is its weakness. And the research also shows that when she looks at every example of courage with people showing up in their lives, there was always vulnerability in that mix. So whether that's starting a new business or like waiting to talk to the doctor, or, like Jillian said, going back to get her expanders, or like all those things that those things take courage, but there's always so much vulnerability in our most courageous moments. Because it's the courage to show up and be seen without any guarantees of what the outcome necessarily will be. The second vulnerability myth is that we can opt out of it. And she's really good at laughing at herself because she feels like this research it landed at a place that she hoped to never be in, because she says she's not the poster child for vulnerability because she really hates it, right? But to be alive is to be vulnerable. And at the crux of all the research, vulnerability ends up being even though it's really terrifying, it can feel awful in the moment, is also the birthplace of joy and connection and creativity. So we can't get the things we really want most in our life without stepping into vulnerability. And I had one client that just says, like, I love how she talked about radical acceptance. She goes, it just sucks and it is. Someone's like, that's how vulnerability is. It just sucks and it is. Like, it's what we have to do, but it's never a comfortable process. And even though I know about vulnerability, I talk about this all the time, I'm very comfortable sitting with clients and hearing really tough things and sitting in those spaces with them. I think any therapist would also state they don't love being vulnerable in the moment you're doing it, because it always feels hard in the very moment. That's usually when you know you're up against something that is more vulnerable, because you get that like anxious, sweaty palm, like, ugh, I don't know what this person's going to think. I don't know how this is going to go. I might fall flat on my face, and that is always terrifying. The third vulnerability myth is that we have to let it all hang out. And she says, vulnerability isn't sharing. Her example is, you don't share your bikini wax over social media as like, that's not vulnerability, right? That's could be oversharing. You don't share, inappropriate things, with to your children about if you're going through a divorce. Like, it's not oversharing. It's actually finding people who've earned the right to hear your story and who have proved themselves to be trustworthy to share the things that are difficult for you. And the fourth vulnerability myth, and this is, I think, the one we all want to hang on to sometimes, is that we can't go it alone. Because I think we all have this sense of, well, sure, I'll be vulnerable as long as no one has to see it. I don't have to talk about it. I don't have to, I can just kind of conquer it on my own, right? And the thing that always kind of hits me with that is that we're infrequently hurt in isolation, and we infrequently heal in isolation, right? And so, a lot of body image components in my mind are actually caused and created by exposure over years to culture at large about, media impact on body image, our circles of influence, our family of origin, all negative interactions with people that have made comments about other bodies or our bodies, or, our fears. It's come from a reason, and we have to do our own internal work, most definitely. But on this front, also healing can come by having a positive experience with someone who has earned the right for you to share your vulnerabilities with on the body image front. And the other thing just to remember is that we're hardwired for connection. That's just actually a survival component. And being vulnerability is kind of one of those life requirements that we can't get ourselves out of if we want to actually truly be connected and be in authentic relationships. So Brene Brown defines vulnerability as uncertainty, which no one loves, risk. There's, that depends on how risk averse you are or not. And then emotional exposure. And to me, that's kind of the kicker, is that when you're going to have emotional exposure and you're not sure how it's going to play out, right? Which requires a risk. And so the question I have for you is, how is vulnerability for you? And you're not going to have to answer. I just want you to think this for yourself. How is vulnerability showing up for you in the bedroom? And it may be showing up differently today than it was a week ago or a month ago or a year ago, or maybe showing up a lot more right now than it was in the past, because that's going to look really different depending on where you're at in your cancer treatment, where you're at with your body image, where your relationship is currently at, kind of what's happening in your overall world, because external stressors certainly show up in our emotions, and our emotions show up in our body image. There's actually something I referenced last week in the talk, but we didn't get to talk about, and it's called mood mirror. And it's a concept that I knew, but I just didn't have the catchphrase for it. So I gave the attribution to who the catchphrase came from in my field. And the speaker talks about mood mirror, and she says, if I have a really great day at work and everything goes well and my sessions go well, and I look and I have more money than I thought I had in my bank account, and I hit traffic and I hit a ton of traffic on the way home, I get ready to go on a date with my partner, and I might look in the mirror and think, oh, I look really good. If I had a terrible day at work, I hit a ton of traffic, I realize I got an overdraft notification, I could put on that same outfit and look in the mirror and have negative criticisms come back at me because of my mood. So I think that's one thing that's super important to pay attention to, is where is my mood, instead of just assuming that our body is the problem, because that's where we kind of default to, versus, okay, how is my mood affecting my body image in the here and now? And checking in, because if you can re-regulate your mood, then usually your body image improves because your mindset isn't as critical. Okay. So a few things just on body image, just for those of you who are there, is body image is really more about our beliefs about ourselves and our body, and then kind of the backstory to what played into that. And obviously, you can kind of look at the webinar from last time to do a deeper dive into that. But a few things we'll just highlight on, which is body safety, which we didn't really touch on last time, but I think this is really relevant for intimacy, is whatever your sexual experiences have been in the past, depending on if they were consensual or your consent was violated, will impact your ability to feel safe in your body, full stop, and then to feel safe in your body with intimacy. And obviously, if anyone's had that experience, therapy can be super helpful for that. But also just to give yourself some grace that if that's your experience, that you have to factor in how to give yourself some compassion and communicate with your partner about what will help you feel safe enough. Then body trust is like kind of the messages you learned growing up, right? So did you learn to trust your body to know did you learn to trust yourself to care for your body? Do you feel like in the process of the cancer treatment that your body betrayed you? Which a lot of people feel like with illnesses, it feels like your body betrayed you. And then, so sometimes that can shift those stages of grief, right? With the resentment or anger, either towards your body or at your body or from your body, that emotional component can be there. Even if logically, that's not actually how it plays out emotionally, people with chronic illness or acute illnesses will report feeling kind of betrayed by their body. And then of course, we highlighted the cultural impacts around beauty. And then whatever your beliefs were about your body. So I'm going to ask you a couple of questions really akin to what we just did with vulnerability. So just fill in the blank. My body is blank. My body feels like say any answer is normal, is what I would say. It could be a wide array of what that could be. I grew up believing my body was blank. And that could be on body image, that could be on functionality. There's a lot of factors could go into that. So then I just want you to think about were there any similarities or differences in your answers to the vulnerability questions? And then the body questions. Some people will have very similar type of things and other people have very vastly different experiences. Once again, not a right or wrong answer, but for women, vulnerability, especially, just the physical act of being naked in a culture that is critical of bodies feels incredibly vulnerable for most people. It isn't something that people do regularly outside of the context of intimacy. And there's some exceptions to that. I'm sure there's places we can go to, nudist beaches and such, but for the most part, that's just something that isn't approached very often. And so there can be a lot more head chatter. That's what I call that about that. Okay. And so when it comes to the bedroom, the reason why I chose the words courage and compassion, because I feel like they're kind of the values that get us through the hard things and the things that kind of give us direction and guidance in how we approach this tricky topic. So the definition of courage in the research Brene Brown uses is to tell your story with your whole heart. And that's taken from the Latin version of the word courage. And I really like that idea, is telling your story with your whole heart. And then compassion, I think in this case, I think we need compassion for ourselves as our number one thing. And then I do think we need compassion from the person that we're going to be connected to and intimate with, because obviously a lot of the anxiety is about head chatter is about your own beliefs, but it's also potentially fear of judgment from others. And so a couple questions I just want you to think through. Once again, not a right or wrong answer. Does your partner know how much courage and compassion it will take you, or that it does take you, or has at times taken you to show up in intimate ways during and after cancer treatments? I know that sounds like an interesting question, but I think there's an assumption well, of course, because they've heard me talk about, feeling sad about losing my hair or the impact of the surgeries. But other times I feel like it's not as obvious as we think, because we've experienced that. Maybe we've sheltered them from that, or maybe we've really never talked about it directly in context of how that makes you feel or how vulnerable you feel and what your internal stories are when it comes to being intimate with them. And so that's just a question to pose to look at, like, would that be helpful for me to actually have a really vulnerable conversation about that? And the second is, does your partner need to know how much you need some recognition for being courageous in that way? And understanding, like, can they give you some support and some compassion before intimacy, during, and after? Right? Because like I said, our brain has to come up with internal stories to explain circumstances. It doesn't have to be accurate. And it usually aligns with our fears or our negative head stories. But oftentimes that's where a partner can actually kind of help counter those negative internal stories, if they kind of understand what it is that's difficult for us when we show up for them. If they don't understand the context, then you're not going to know how to respond. And the other thing that I would state is the number one thing I see just in general in therapy, and arguably this tends to be more when I'm working with a cisgender woman with a male partner, is the difficulty in being what I call ultra clear with him about how you feel. Because sometimes we feel like if we tell someone exactly what we need and then they give that to us, they're just doing because they have to. And what I usually find is when I'm working with partners is they're saying things to me like, I love this person and I value them and I want them to feel loved. And I don't always know what to say that actually would help them. But if they're kind of told what that is, they actually like, yeah, I believe that. I agree with that. I don't know that I would have thought to say it that way, but yes, I'm on board with that. That is true for how I feel. And then they can actually state that thing that would actually be most helpful. And that is vulnerable to even have that conversation, no question. But I think that's something kind of worth, like, at least putting out there. So we'll just briefly kind of go over self-compassion, because obviously we've got courage to have any type of conversation or even just to show up, right? And then just wanted to briefly highlight the components of self-compassion. And so obviously it's self-kindness over self-judgment. And kindness is like actively wanting to give yourself some compassion and alleviate your suffering. Common humanity over isolation. So framing our experience in context of community or common humanity. So body image struggles, I think, is something that most women deal with when our bodies change, be that from aging, surgery, illness. And the more significant that change is, and the more that change impacts our sexual identity, the more tricky and complicated that can get, which is why I love that you guys have each other in this group for all of those reasons, because it's so helpful to have people that can just get it. Even if their experience isn't exactly like yours, it's still fundamentally, everyone knows the vulnerability of the diagnosis and the treatment and how exposed and tricky it is to walk this journey, right? And so there can be support and community. And so that could be texting or reaching out for support beforehand or afterhand regarding intimacy or body image struggle moments. And then the third step of self-compassion is mindfulness versus over-identifying. So being with ourselves in the struggle and turning towards our struggle instead of like trying to just jump ourselves out of it, we actually tend to then ruminate more. And the more we kind of ruminate and run in circles, the less present we're able to be. And so we'll talk in just a second about how that actually ties into intimacy. So I always say, how do you know if you're standing outside of compassion when it comes to body image? And one would be body judgment, because we just talked about kindness over judgment, right? So that'd be negative body talk or apologizing for our bodies. And there's a great book that I listed in the resources, The Body is Not an Apology. And that person specifically discusses that idea came to her when she was talking to a friend that had a disability that didn't feel like she had the right to make certain asks in sexual relationship because she felt like she had to kind of overcompensate for her disability. And this person said, like, your body is not an apology. And I think that was really powerful in that moment for her and that friend. But I think just as a generally speaking concept, I think in our culture, women feel like they have to apologize for their appearance all the time. We feel like there are certain things that we feel like we have to give and owe other people on the regular. And so I think most definitely in a very intimate way to check yourselves, do I feel like I have to apologize to my partner for my body? And if the answer is yes, then like to just with gentleness, look at where does that come from? Is that coming from my partner? If so, how do we address that? If that's coming from me or kind of what we call the cultural narrative, is I think a great way to frame that up, is that coming from the cultural narrative? And if so, can I give myself permission to put some space in between me and that cultural narrative? Because you don't have to apologize for your body being the way it is. Now, like I say, there can be grief around this, right? Because we have body image narratives and we have narratives that identify like what we identify to be our sexual identities. And obviously body changes really challenge that significantly in most cases. How we know we're out of self-compassion with body, like that common humanity versus isolation, is in my mind, that's when we're avoiding attending events or wearing certain clothing because we are uncomfortable with how our body currently looks in the here and now. We take that one step farther to the bedroom, that would be avoiding intimacy because of shame or feeling badly about how our body looks. And not judging that, it's just stating like, oftentimes if we're caught there, it's usually because we are in that self-criticism or in fear, which are understandable emotions, but we usually do better if we can get that common humanity and normalize our experience so we can show up in the ways we want in our relationships when we choose to. And then the third one is that body over-identification or rumination. So it's having that internal negative narrative and it being so consuming that you can't actually be present with your partner. Sometimes people experience this with, I had one client that even just with an eating disorder, with just hugging her partner, all she could think was self-loathing thoughts the entire time, right? And that was in a very non-sexual construct. So of course, then when it came to intimacy and sex, that was like a whole different ball game. So what I had her practice doing was just, even when he would hug her, is just for her to focus on like, what did his body feel like to her? What did she find comforting about his body? And to really kind of help her get more mindful about her tactile experience and her emotional experience of being connected with him. In her case, she did have a lot of trust and connection to him. And so that was helpful, right? And then we kind of helped her take that and apply that, to intimacy as we kind of move forward. So a couple things, and I just thought we'd talk through like some tips of like things you could do, and then we'll kind of open it up for questions, is looking at like how you can have body compassion before the bedroom. And I know we talked about this in the bedroom, but I think before the bedroom most definitely counts, because if you're having a day where you're suddenly caught in criticism that day, or let's say you see a picture of yourself before your surgery 10 minutes before you're planning to be intimate with your partner and your mood gets really thrown, or criticism starts to hit hot and fast, or comparisons, then what we want to do is what I just call the 3 C's. So we want to learn, the first C would be that criticism or comparison. So we want to shift into curiosity and think, okay, what is coming up for me right now? What am I feeling and where is this coming from? What just set this off? Because if we just judge our emotions, we can't ever figure out what's happening, which are our tendencies to judge, for the record. Because we don't like how we feel, and we sometimes feel like if we could just judge it, we can get out of it. But actually curiosity is our friend in helping us identify what happened and shifting. Once we identify what's happened, like, oh, I looked at that picture and I, had a lot of sadness or self-loathing about how my body looks different now versus then. Okay, then we understand the context. So it's helping our brain start to settle. And then we can shift into compassion for ourselves. And we talked about that a little bit about this last week too, is like, right now, what part of me is hurting and how can I nurture myself through that? Because usually when we compare to someone else or ourselves, there's some pain there. There's some loss there. there's an expectation we feel like we aren't meeting. There's a desire or a wish there. And so like and when people, sometimes people are like, I have no idea how to do that compassion piece. That just is such a kicker. So then I just state, like, if your best friend had just told you what just went through your head, genuinely, truly, what would you say to him or her? Because most often we actually have the answer inside of us. We just are so caught in like we're the exception to the rule that we don't know how to access compassion we actually already have. We really have that compassion for other people. And so it's doing that best friend test can come and be like, okay, if this is what I would say or do for my friend in the situation, what can I do, say to myself and do for myself right now? It would help me feel calmed or soothed or understood. And that could be something like, oh, this is a really painful thing, and this feels really scary to approach intimacy, having just like had that like really critical judgment come up. Or maybe I need to talk to my partner and say, oh, scale of 1 to 10 today, like me showing up tonight or today in this moment is going to take like 9 out of 10 on the courage scale for me, because my head chatter is really strong today about my body image. And so that we're kind of giving ourselves that space and compassion. So the 3 C's is one tool, and I can zip these over to Jillian. I had a PowerPoint presentation, but I thought if I had it up, I wouldn't be able to see people's faces, and I thought it would just be easier to do it this way. The other one is to practice mindfulness, and this is, we're still in the before the bedroom. And mindfulness is a skill that actually we all struggle with because our brains like want to ping around all the time. But mindfulness when we are being intimate is actually really helpful from a safety standpoint and in combating some of that negative body chatter. And so practicing outside of the bedroom is a better shot of building a skill that then we can use in the moment. So I always tell people, like, if you want to practice mindfulness, as long as this doesn't bring up OCD issues for people, is like just as you're washing your hands. So we usually do that most few times a day if we use the restroom, right? Is just to pay attention to like, what do the suds look like as they're on your hands? What is this texture of the soap? What's the smell of the soap? What's the temperature of the water? How is it flowing over your hands? It's, that 10 or 20 seconds that you're trying to just be fully participating in that moment. And I like it because it's also tactile, because I think mindfulness is a little easier done with multiple senses. We've got smell, we've got the sensation, we've got the visual component. It's just a great, in your mind will wander because this is just what it does, but it's a good way to just practice like trying to be mindful in something that's pretty innocuous, but gets that practice going. Another mindfulness practice is just box breathing. And it seems like someone in the prior, I think a couple weeks ago, talked about box breathing. So that's just where we're doing some deep breathing. So usually it's best to start actually with an exhale. So breathe out first is what I always tell people, because it actually gives you an increased capacity to breathe in, especially if you're anxious. If you breathe in right away, sometimes you get more anxious. So breathe out. Then you're going to breathe in for 4, hold, out for 4, hold. And just do this 3 or 4 times. And it helps your nervous system start to calm down, which then helps your thoughts slow down and helps them be a little less critical. When our thoughts get racing quickly, we jump to more extreme conclusions. It's just how our brains work. And so then we can tend to get into higher critical self-talk. And then the other option for mindfulness is practicing neutral descriptors for your body. Oftentimes when we describe our bodies, we attach judgment. Some of that's from that cultural narrative about, my body doesn't look a certain way, or we describe negatively is just describe yourself in a neutral or positive fashion. So that could be just even like standing in front of the mirror, just describing what your face looks like in a very neutral way. It could be, I think I sent over the TED Talk. I'm not sure, Jillian, if it was in the newsletter or not. There's a TED Talk by Emily Nagoski. She's a sex educator. And she talks about this practice of either standing in front of a mirror, which I think is really hard work for people to do. So I always would say, don't necessarily start there. Start with the other option that she gave, which is to just stand at the door of like sexuality or your body and just practice sending love and kindness towards yourself. And honor that sometimes is just a hard effort to do. But neutral descriptors, I think, can be helpful. because like I said, we're used to describing things, and even practice with like, not yourself, even just look at something in your room and just describe it in a very like neutral way. Like, okay, it's this tall and it's this color and it's this shape, without a judgment. It's actually harder than you would think, because we learn to judge or put things in categories as kids. Like, so if kids learn like something that has 4 legs is an animal, then everything that has 4 legs is an animal. So even if there's brother or sisters on the ground on their hands and knees, and they're an animal in that moment. Does that make sense? So our language skills kind of force us into categorizing, but then sometimes that can like play out poorly on the body image front. And then before the bedroom is just thinking, what is your approach? What does my partner need to know before we are intimate for me to feel safe enough? And that could be safe enough from if there's been a history of trauma, or just safe enough if that hasn't been the case, just from a body image standpoint or a vulnerability standpoint. And a lot of times that's just knowing, that's them knowing that this is vulnerable and hard, because it may not be obvious to them, because maybe you're used to kind of seeming like you're okay. And I just find sometimes people are just not super aware that their partner is in as high vulnerability as they are. And so then they come at it more logically and not as like emotionally connecting or soothing is what our nervous system needs when we're feeling more vulnerable. And then what do you need from you in order to feel safe enough? And sometimes that's a trickier question to answer. So one idea on that, so as you, and we're going to shift into body compassion in the bedroom, is what is a statement of compassion or a mantra that you come up with for yourself? And that's really going to vary. And one thing that I say, this is probably oversimplification, maybe, but is I'm working with people who are kind of getting anxious about this, and not people that have significant body image issues, but just more middle ground. If they're gonna, you know, they're in a new relationship and they're gonna be intimate, is just like kind of just grounding someone on the facts that like, if this person cares about you and loves you, then your naked is good naked, because they love you. And women, the research shows that women are far more self-critical about their bodies than men are actually about those same bodies. I haven't looked at a ton of the research coming from other women, but like women are across the board, if your partner is female, are used to being kind of exposed to that self-critical stuff. So I have to think they would come in with compassion as well. So I would say when you're in the bedroom, choose a compassionate statement for yourself. And then try to be present. This one is tricky because, you know, half the time you're thinking, you know, you have had a long day and you're thinking through what do the kids need, and here's my, you know, duties for tomorrow. The more you can get present in the moment, the more likely you'll have a more positive experience. Because when we're not present on superficial things, then it's easy to hop into not being present in self-critical ways. So that's where it comes back to like with that client where I had her just practice on like, what does your partner, like, what do the sensations, like, what does his or her body feel like to you? What's comforting about this? What pleasure are you enjoying in the moment? Can you give your partner feedback? With some clients, I've told them to do what call, one of my clients was like, well, how do I, like, what if I'm not present in the moment? If I get unpresent, then I spin out in my head and then I check out and then things go poorly. And she's like, my partner is really into sports. So I was like, okay, well, what if we practice what I just came up with on the fly, was what we call the double tap, because he had been into wrestling. And it's like, so tap out. So we say, so she would train him like that if she wasn't present, and she also had some trauma history too, so she was trying to be in the moment, that she would just double tap him if she couldn't use her words, and double tap him, and he would know no matter what, immediately that meant all bets were off, stop, immediate halt. And then they would work on some grounding. She would work on trying to ground herself if it was appropriate to resume or not, but she would try to get herself back into a place that felt emotionally safe and present in her body and focused. And if it wasn't, she couldn't get back to that place, that was completely also okay. But that was just one strategy from a safety standpoint with trauma history, but even just from a body image, being present in the moment was a good way for them to communicate. And when I've worked with partners on this, they really do want the person they care about to be present. and they want it to be positive for them, and they don't want to proceed unless it is that way for their partner on all levels, right? And so I think the double tap, which is a good nonverbal way to kind of articulate, hey, we need to take a break for a second. The other thing I would say is to befriend your body grief as it surfaces, because it could come up actually in the moment. And so when I say befriend that, just that, like recognizing like, oh, I'm feeling some loss right now because in our prior sexual interactions, this brought me pleasure and now that isn't an option. Or I'm wondering if my partner is thinking this right now in this moment, and to just name it and normalize like, oh, this is painful or this is hard. Do I need to stop? What do I need right now? A lot of times we want to just kind of quickly like stuff everything down and pretend it doesn't exist. And that actually usually sets us up to get more dysregulated, or to have it kind of, it's kind of like one of those rubber bands we pull back further. The more we ignore it, the more we pull it back. Then when it breaks, it pops forward, it flies forward with like a lot more intensity than if we actually would have just attended to it sooner. And also because when we name and normalize something for ourselves, it helps our body be more calm. Our body gets really dysregulated, our brain gets really dysregulated when we can't figure out what is happening to us. So even just labeling, ooh, this is a grief moment, or this is a negative body image story that's coming up for me, that's tough. What do I need right now? Or, oh, that's understandable because this is a normal part, unfortunately, of my cancer journey. So I'm gonna have some body grief that shows up until I get more comfortable with intimacy with my partner. Or even after I've been comfortable, maybe, you could be doing really great and you might have a day where it just pops up and there's loss or sadness or anger or fear around that. Make sense? Okay, then last topic, and then we'll kind of open up for questions, is body compassion after the bedroom. And I think this one's also super important because a lot of times we do a lot of really hard things in life and we don't stop to give ourselves some compassion or credit for what we just did that was hard. And sometimes we're the only one that's going to know how hard that was, because we're the only one living in our bodies with our knowing what's challenging for us and what's not. Even though our partner can know us really well, it doesn't mean that they're going to know every single thing that was hard for us or everything. So I always say, like, after the fact, be this just to yourself, or if you want to write down, just identify some wins as you're moving in this process. Give yourself so much grace. If you can't show up, give yourself grace for that. If you can show up a little bit, but not all the way, give yourself grace for that. If you showed up and it was hard, give yourself grace for that. Always give yourself grace, because body image is really tricky and sex is very complicated, and we combine those two elements and this can get really hard. Remind yourself that your feelings, or sometimes those internal narrative dialogues, are actually not facts. They're beliefs that are really painful and really strong about our bodies, but they don't mean they're facts, and that doesn't mean it's actually what our partner thinks. So sometimes we even need to check the facts with them. Because my experience is most time, like, what you're thinking negatively about yourself, your partner is pretty much oblivious about. It's not what they're thinking at all. And sometimes that can be helpful. Another option, a lot of times people ask me, well, what can I do to help my partner get this? Or how do I communicate this? And one way is even just talking. It's a real soft way to come at it, is just, I need more of this from you and less of this. Or even to pose that question for myself, what do I need more of or less of before, during, and after intimacy for myself or for my partner, when I'm adjusting to these new circumstances in my body. Another option is watching, has anyone ever watched the Brene Brown Empathy Bear clip? Okay, Juliana. So it's like 2.5, 3 minutes. Just Google Brene Brown Empathy Bear. And it's Brene Brown speaking, and it's a cartoon sketch. And it kind of just walks through, when someone shares something hard, what invalidation looks like and what connection looks like. And it kind of just walks people through, like, even if you don't know what to say, just saying, I'm glad you shared, is helpful. And it's a great one that I do a lot of times when I'm working with partners or parents or whomever might be giving my clients support, is looking at that. And it also kind of shows an example of invalidation. The person goes to hand someone a sandwich. And so one of my clients, that was their cue word. She would tell her partner, like, oh, you just gave me a sandwich. Like, I needed you to like sit with me and in my feelings, not try to problem solve me out of my feelings. Or he would then be like, oh, did I just give you a sandwich? She's like, yeah. He's like, okay, do over. Let's have a do over. And that was just a fun, playful way for them to attend to the empathy miss just in their relationship, and let alone in the bedroom, like versus, connection versus disconnection. So that's just a little 3-minute clip. And then there were some resources I sent over to Jillian that she can send out. There was the TED Talk by Emily Nagoski, who's a sex educator. She also has a book. I haven't read it, but I have some colleagues that love it, that are in the sex therapy world, called Come As You Are. But she also has it's not a TED Talk, but it's a different talk that I watched of hers the other day too. And she talks about how in relationships, we often have what she calls hedgehogs, I think. I remember laughing about that. It was super random. Hedgehogs that get into our relationship that then affect our ability to show up and be present sexually. And sometimes that could just be demands and work demands and tired and like just different things that affect that. And that every relationship has this backstory of things that show up in our relationship and then our sexual relationship. And then also Brene Brown does a really great TED Talk about shame and vulnerability and connection. I don't think I listed it, Jillian, on yours, only because towards the end, she has some commentary about weight that implies weight bias, that I always like to give a trigger warning about. That her assumption is that people's weight is a direct correlation with food, and the research and eating disorder camp sees that differently. And it was also, she gave this years ago, so she may not embrace that narrative, but I thought it was triggering and shaming towards people in larger bodies. So I just like to throw that out there because it's only a snippet of the talk. The rest of the talk is fantastic, but I do like to put that out there because it's accurate and contributes to some of that negative body image and self-blame. So with that, those are some of the resources. I thought I just open up for questions, comments, whatever I can do to kind of be supportive. I know it's a complicated topic and it's probably pretty vulnerable to even ask questions, but obviously what you say in here stays in here. I'm assuming that's true, Jillian, but happy to field questions or comments or whatever would be helpful.
I think this topic is so important. Ooh, is there an echo when I'm speaking?
Now there's not. There was for a second. Now it's
okay. This was, I think, for me, one of the hardest. I was talking with Natalie this morning. We had a call, and it just did, like, this topic of just being intimate afterwards just was, and it's still sometimes, there was just so many things that you commented on or said during this this meeting that, like, yeah, that's so true, and I think it's gotten better. I certainly have gone through the stages of the body grief, and I'm happy to say that I'm now like in the finding purpose phase, but I still sometimes find myself going back to other phases, right? And I found that your webinar so interesting last week about the cultural narrative, and like where I've been thinking all about now, like where have my perceptions about my body come from, or the way I need, or how I live in my body, or how I treat my body. I don't know, how has it been for other people? I'm curious how other people have, think about that. For me, it's just, going forward, I think about like, my children and how I can try to change that circle. For sure, that's important to me. But this is definitely something that I have to work at regularly.
And I'll let everyone think about that for a second. The cultural narrative is really strong, and in the Body Is Not an Apology, the author is Sonia Renee Taylor. She does a podcast on 10% Happier with the guy's name who I'm just forgetting. And they're
It's
talking
in
about
our newsletter.
yeah,
Yeah.
yeah. So it's talking about the radical self-love, and she does some other talks. But what I liked about it, because she was framing some things up for him in context of male, white male struggling to accept like radical self-love, but she was talking it too about like privilege and racist some things, and she was just talking. They were talking through how when you can identify the cultural narrative as not your own, it's easier to label it and to not take to be able to like move forward for yourself and not feel bad that that's been your thought pattern or a belief, but to recognize the construct of where it came from and step forward and step out of it, or look at how do I need to shift the impact of that on me in the here and now, right? And diet culture is what we call in the eating disorder world diet culture, which is this belief that like we have to always be curating, shifting, and changing our bodies to appease everyone, and that our bodies cannot be okay or remain the same unless we are actively controlling and changing them, is a false construct. And there's a whole lot of history that goes into that we won't step into today. But honestly, each of these different topics, we could do a 4-hour, like we could do a 3-day seminar on body imagery, and we could really unpack and dig into these, because a lot of times when I'm working with people, they don't even realize how much that narrative is around them. And like I said, if I make it 3 days in my personal life, and people know what I do, but it doesn't stop the craziness sometimes, is if I make it 3 days without someone making a negative comment about feeling guilty for what they ate or didn't, or exercised or didn't exercise, or about how they look, or some negative body commentary, it's either a miracle, or I'm at an eating disorder conference with my eating disorder colleagues, and we've all done our own work around these issues, because it's just that pervasive. And I can think of a few friends I have that don't ever comment on it, but it's just 10 or 15 years ago, it was common, but even now in the last 10 or 15 years, as I've been in my profession, it's like pervasive. It just gets stronger and stronger.
Well, I think that's why this is such an important topic. Like it felt for me when I was first diagnosed with breast cancer, like, and all of these changes that happened, I went from finding out I had breast cancer, and then 11 days later having a mastectomy. And it wasn't even like I didn't have time to process anything at all, but it felt like such an attack on my womanhood, right? There were it was like ripping off like a scab on a band-aid of all this like prior life experience that existed for me in perceptions about myself and body image, and where I thought I was comfortable in my body. I clearly wasn't. And I had done some therapy through, for past experiences that had happened to me. And it just was like, whoa, I couldn't believe how much more I had to work through. And I think that that's a common thread in my community, of my cohorts that I speak to, that they have similar experiences. And so I really appreciate you sharing with us today this, ways in which we can have courage and compassion in the bedroom, and tools to use before, during, and after. I certainly, I'm going to be looking back over my notes here and thinking about them. And so I really appreciate that.
And I love it. I just think it's a practice, right? I think sometimes we just think we should magically feel okay about whatever the topic is all the time. And I don't know that that's accurate. Like, yeah, I would say I came into this world with very few, like I was raised in a very body, like neutral, stay in your lane, not comparison land, parents had a healthy relationship with food and bodies. And I realized when I started working in eating disorder treatment that I had some beliefs that had just come from the cultural narrative. And I was like, whoa, I don't even agree with that, but like, or whoa, why did that just come up? And I had to do a lot of my own work around unpacking that. And it took time, because like, I think I had really worked through belief sets about things, and something else would come up and I'm like, oh, there's an unhealthy belief. Where do we go with that? And so it just takes time and exposure and practice at doing that. And self-compassion, I think, is, if there was one thing that you just chose to like learn more about, I would say it's self-compassion, because it's just something we don't fundamentally, I think, come hardwired to do a ton. but I think it is our best strategy in loving ourselves through the process of our emotions and our body image and all the things. And I had done really good work on it. And then I went to a 5-day self-compassion conference, and it still was so, so helpful. And I'd done a ton of the reading and trainings, and yeah, I still came away practicing, having better practices about shifting internal narratives. And now a lot of the narratives over time that I had, the more I practiced challenging or being compassionate when a tough narrative came up, or reaching out to a friend for support that I was caught in a narrative, or a partner, whatever the case may be, like over time, my beliefs have softened, or I don't even think some of the same beliefs that I used to think anymore. That used to be natural, automatic, self-critical thoughts, right? And the ones that still come up, the constructs around compassion, getting curious and having compassion always help support me better in any aspect of my life that feels vulnerable, or the negative head chatter comes up. That's what I call it, negative head chatter. We all have it, shows up. So, but definitely in this area that's so vulnerable, because like I say, sexual identity is a complicated topic too, and lots of nuances that go into that. So, any other questions or comments? Okay, well, are we at time, Julian?
I don't even know what time it is. Yes, exactly that time. Well, thank you so much, Wendy, for this. Gosh, I do know that there could be so many more offshoots of
Yes.
sessions we could do, or maybe we should do.
Yeah, I'm always happy to help out. So if down the road something want me to talk about it, or have me connect you to someone else that has more of a subnation, one of the areas.
Yeah,
I do have a colleague who's a sex therapist and used to do body image work too. So happy to help connect you guys with whatever would be helpful.
Yeah. Okay, great. Thank you so much. Really appreciate you, Wendy.
Thank you guys.
Everyone have a great day.
Bye-bye.
Thanks, everyone.